The Pediatric Lounge, a podcast taking you behind the door of the physician's lounge to get a deeper insight into just what docs are talking about today. From the clinically profound to the wonderfully routine and everything in between. Hi, George. Good to see you again.
How you doing, Dr. Bravo? Today we are here in the afternoon on Tuesday, elevating great soon-to-be physicians now, where we have the medical student series, and we have a very dear friend of mine, Spencer Shain, who, it's sad to say, but I saw him when he was born in the nursery, and then he grew up in our office, and he became one of the RBK Padawans where he shadowed and he followed and he did stuff, and now he's in medical school. So I think I had a hand in raising this boy, a little bit.
Oh, poor kid. Welcome to the podcast, Spencer.
Thank you for having me, and thanks for a great introduction, George. I appreciate it.
It's a pleasure. So other than the brainwashing from George, why did you go to medical school?
Well, everyone says that they want to help people, and that is part of it, but in reality, I wanted to go to medical school because I wanted to be part of the community and give back to the community and give back to what my the upbringing that I had, where I've had certain people go through certain ailments and illnesses, and I wanted to be part of the medical team. And I've seen all these diseases and whatnot that all these people have gone through, and I've always found an interest in it, and I always wanted to better the healthcare field and pursue a job in that where I could, bring in a better
Outcome.
Outcome to patient care.
So how did George's mentorship influence your decision?
So we met in my early days of high school through his son, and obviously he was my physician for however long, and I always saw that he had great patient care. I really enjoyed the stories that he would tell about going in and out of rooms and all these patient encounters that he had whenever we would talk outside of the office, and it really sparked an interest in me in becoming a doctor, and it pushed me to applying to medical school and being where I wanted to be today. Originally, I didn't really think I wanted to do medicine. I started as an engineer, and my engineering curriculum didn't really have much of a biology background to it, which I really found an interest in early college and high school. And once I was in that transition period between, okay, I don't think I want to do engineering, but I do like biology, I shadowed George a little bit, and it really pushed me over the edge to make that final call and go into medicine.
Wow. What experience do you have in business, especially business and medicine?
So in terms of business, I've been surrounded by business owners my entire life. My dad owns a business, his best friend owns a business, various family members own a business. And what really sparked my interest into it was working at one of his friends' warehouses, where I would see the ins and outs of what was going on at the warehouse and how he would manage his balance sheets. And I was on the floor doing inventory and shipping out orders. And it really sparked my interest in managing a warehouse and managing a business as a whole. And that further evolved into taking a little bit of more interest into my dad's business. I've noticed that George has always been involved in private care. So it really sparked my interest in management and overall just business. And then once I transitioned to the medical track, I worked during my gap year as the office manager at a local primary care office. And that's what really put me over the edge in terms of learning how to manage a business and run flow sheets, run balance sheets. And it really inspired me to want to possibly go into private care after working directly under a private practice physician.
So what kind of business does your dad own?
My dad owns a mold remediation, environmental testing company. He goes into people's houses, tests for particulates, volatile organic compounds. And what he does is he tries to explain to these people why they might be getting sick in their homes. So if you have let's say you have asthma and medication isn't working, and you've been going to various doctors and whatnot, and you just can't figure it out, my dad might go in there and he'll test for VOCs or mold and whatnot. and find environmental particulates that may be exacerbating disease.
Oh, wow.
Let me tell you an interesting story with his dad. I say that his dad single-handedly saved the private pediatric offices in Suffolk, Long Island from the COVID pandemic. Because at the beginning, if you recall, there was no N95 mask available anywhere.
Yeah.
Somehow I must have put out a post or something on Facebook that if anybody has any to donate, that can get them out to the community doctors and to our office. One day, he shows up in my office with a huge box of N95s because he had an environmental company and they were using these things. So we had a lot of them. And I was able to keep some for my office. I gave some to another 2 or 3 practices around that are within our clinically integrated network. So everybody had enough to function until production was ramped up a little bit on the mask. So
Oh, wow.
thank you, Michael Shain, for helping us, and the community help. Thanks you.
Oh, that's very cool. And then what kind of independent practice were you the office manager for?
So it was just a primary care office. It was local to Suffolk County, local to the Huntington area. And what I was directly involved in was running the accounting a little bit of the business, doing some managerial. So I was hiring, I was managing personnel. And in terms of the medical side to it, the doctor would allow me to shadow, and I would see his take on managing a business. And he would compare and contrast what his business was like to what it might be in a hospital where you have various administrators here and there. So it
But
really,
what was his specialty?
he was just primary care.
Like family practice or?
Correct.
Okay. All right. So that must have been very interesting.
Yeah, I loved it there. I would recommend it to anyone that needs a doctor to go see him, obviously outside of the pediatric world. But we had a great relationship and we still keep in touch. I really value that experience.
Yeah. Family practice see some kids, but not a lot. And so you're involved in something called Business and Medicine Club at the medical school. What's that? I never saw that in medical school.
So I'm the president of the Business and Medicine Club here at my medical school. And what we do is we try to inform and educate medical students who may not have a business background or maybe slightly interested in business, because medicine doesn't really go over these kind of things in terms of personal finances, in terms of maybe learning how to or what a private practice physician may do. So we have a few upcoming events. For example, our it's coming up the soonest is we have a white coat investor company. So a lot of people have heard of the white coat investor. They put out a book that many medical students have read, which goes over how to manage your finances as a medical student. So we have one of their affiliates coming in to talk about student loans, and he wants to speak about how the Biden administration's student loan forgiveness plan may impact medical students. So we're hoping to get a good turnout for that, because most likely the mass majority of students are taking out loans. We also have other neat events coming up, such as we have a primary care physician that runs a direct primary care model of business. She's going to talk about private practice and how her model is different from just the traditional primary care. I think she runs a monthly subscription fee, and it doesn't go through insurance. It's pretty interesting. And then we would also like to have Dr. Rogu come in and talk about managing a pediatric practice and what it's like with private practice in his specialty. Other than that, we also have medical malpractice. We have personal finance, just like a workshop where everyone will come in. And we really just want to give a broad overview of the business field and how it relates to medicine, since so many people do consider both to be hand in hand, but a lot of people don't realize how, or a lot of people do think that they're extremely separate entities.
And so how often do you meet? Like once a month or?
Yeah, about once a month. We try to get a different speaker for every event, or once a month. So.
And in the funding, the school gives you an auditorium and.
Yeah, the school gives us a little bit of money. It usually just goes towards food to attract people to come. But most speakers do the events for free. They do it out of their own kindness and their own time. They're usually an hour-long event. The majority of events are over Zoom, so it's convenient for the student and it's convenient for the speaker. For example, the speaker that we have coming next week is from Utah, so obviously he can't make it. So that's our budget.
And how many people are in this club?
So in the club, it we have about 100 people on our email list. And in terms of people that actually come, it's about 20% of those come. But what we try to do is we try to partner with other clubs that may have a bigger impact or population on campus. For example, the Family Physicians Club is going to partner with us on the direct primary care model of healthcare, and they have hundreds of students. That's more of a popular club around here. So we'll use them to get some more participation in our events.
Oh, very cool. Very cool. You might want to check out Dr. Lee Gross on our podcast before you do that event. It's a very interesting model.
Cool. I'll definitely take a look.
And why did you get involved in this club? Are you the president or you're the president?
Yes, I'm the president. Last semester, I went to a few events. We had a private care or a private primary care physician come and speak. We also had a roundtable personal finance event, which I found very helpful. And I'm also very interested in this stuff. I've always been interested in finances, personal finances, how to manage your money, taking out loans, how to pay everything back. So it really sparked my interest. I showed a lot of interest at the clubs, and that's how I got involved.
Very cool. And so what do you think about private practice?
So it's such a difficult thing as a medical student to answer that question, because the private practice physicians themselves will say that there's a still a market for it. Then there are also the practitioners working in hospitals that say there is no market for it. But you really have to weigh your pros and cons and see if it's part of your personality. So when I worked for the private care or primary care office, the private physician, him and I would have conversations where we would go over the pros and cons. I mean, pros, you don't have to deal with all the headaches of managing an entire office or dealing with the real estate and dealing with upkeep on your practice. But then he would say, okay, well, you might take a little bit more home in terms of your paycheck, and you have full control. But if you do go to a hospital, you might be able to do your work and just go home. So it really depends on who you talk to. There's the pros and cons of private practice in terms of everything. But for someone like me who's had an interest in business, I definitely see myself going into private practice at some point. And it's definitely a difficult thing to do nowadays with these giant monopolies and all of these hospital systems buying up all these lower groups. So that the startup costs and the ability to start up is much more difficult. But I do see myself potentially going into private practice as I get older.
And do you have an idea what your specialty is going to be?
Right now, I'm interested in urology. So there aren't too many private practice urologists out there. I know there's a few groups here and there. The majority do go through hospitals because it's difficult to have an operating room and have and manage that as a whole. But there is still a field for that, and it's certainly a possibility.
Yeah. There.
What is your plan B?
My plan B is I don't really have a plan B right now.
I thought I taught you something. Always have a plan B.
Well, right now I'm shooting pretty hard for this, but we'll see. I obviously am keeping an open mind. I do find interest in other aspects of medicine as well. I've always found an interest in cardiology. I've always found a little bit of an interest in orthopedics, but I do think I like surgery right now more than medicine. So that's where I'm at so far, and I've been pushing towards urology as of right now.
Yeah, it's good.
Good.
And so, what do you think of these big, health systems? They own the imaging center, they own the outpatient surgical centers, they own the private practices, they, charge whatever they want. And, the patient's just kind of a cog in this big wheel where they're just trying to squeeze a dime out of every interaction.
So there's pros and cons to everything. As a patient, I think it's actually really good where everything is in-house. You get referred to doctors that are already a part of your insurance network. You get imaging and everything that's all within one system. So as a patient, it's fairly convenient. But also patients do find that it may be a little bit more difficult if they want to go see a doctor outside of that care. And let's say you go to a private practice physician and he doesn't have access to the imaging records and they have to send you to get different imaging here and there. So as a patient, I think it's beneficial for the patient if they are comfortable within that system. But as a medical student and as a future physician, I do think it's a little impeding. The private practices are getting swallowed up by these big corporations, and it's really difficult for them to sustain business and uh, try and manage patient care and be a business owner at the same time. Um, but I do see that there is still a future for private practice. It's just going to be much more difficult, and these these companies are really turning into monopolies, and they're really eating the people on the lower totem pole right now. So it's definitely a difficult situation in terms of just wanting to go into private practice right now. But I do see a future.
The one thing that I
so
learned, Spencer, the one thing that I learned with private practice is, I mean, beating the man, beating the system, beating the network, they make lots and lots of mistakes. They can't get out of their own way. They repeat the same mistakes over and over again. As a private physician, all you have to do is simply not do their mistakes. Do what they do poorly better, and you win. Very simple formula.
So,
What do
so
you
I'm
think?
gonna push back a little bit about what you said, because I think you've been indoctrinated by the big health system. Why do you think it's better for the patient? Do you know what it costs to get an MRI in one of these big, huge health systems?
I don't know the exacts, but I do know that the numbers are blowing up. It's astronomical at this point.
Okay. Do you know how much more expensive it is to go to get your colonoscopy at a self-standing surgical center that's owned by a health system versus a privately owned one?
I don't know the difference,
100%.
really.
Do you know what the average family that's insured pays in health insurance a year?
I don't know that number.
An average family of four pays $2,800, $28,000 a year.
Yeah.
Anywhere from 18,000 to 28,000. So that's a cost your dad has to bear on it's a tax on his business.
Mhm.
And then he has to have a $5,000 deductible. And so when he goes to N somewhat hospital in Long Island that has a monopoly, he has to pay $3,000 or $4,000 for a colonoscopy. But if that surgical center was owned by the GI group that was in competition, he might only pay $500 or $700 for that surgical center use.
Mhm.
The same thing happens with imaging. They also use something called facility fee. So when you go to a hospital affiliated practice, they'll tag on an extra charge for using the facility. And the patient doesn't know about this, but it goes to the deductible. So sure, if you're on Medicaid and you don't pay any of your bills, it doesn't really matter to you how much it's costing. But if you're a hardworking individual, not that Medicaid people don't work hard, but you're running a business, you have employees, you have a family, you're paying your bills, you're paying $28,000 to insure your family. And on top of that, you got to pay $5,000 deductible, and you got absolutely no leverage against these huge companies. You're not really getting better care, you're getting more expensive care.
Mhm.
But of course, the hospital administrators, which they grow exponentially, there are more hospital administrators now than there are doctors,
Right.
will tell you that you can't go into private practice because you can't do it well. Well, this is not true. They just don't want any competition, and they fight by indoctrinating young physicians. They fight by lobbying the local, and local I mean at the state level, something called what's this called? Certificates of needs.
Mhm.
So states like Virginia have certificate of needs. So you can't buy an MRI and offer the service at, you know, 30% of what the big health system here does, because you have to have a certificate of need given by the state, and the big health system will sue you and they won't let you do it. You can't open a self-standing surgical center because you need a certificate of need, and the health system will sue you. So you don't have the pockets to hire the lawyers, so you can't provide the patients with a better option. There's many examples, and if you listen to Lee Gross's example, they can do a knee replace. I think he said a knee replacement or hip replacement for $18,000 wraparound, everything, your surgical costs, your surgeon, your anesthesiologist, your OR cost. while at the local for-profit hospital, that same service, no better quality, costs $150,000. So when you say it's better for the patient, it depends, you know, what better means. I mean, if the outcome's the same, but I'm paying that $150,000, that it really isn't better, right? If you're selling me a Toyota Corolla for the price of a Lamborghini, but I'm still getting the Toyota Corolla, am I really better off?
Not at all.
Yeah. I think it's convenience. He meant to say convenient. People, they think convenience is better. So if they don't have to go too far to get an X-ray, if I have to go too far outside the building to get blood work, it's better care.
But we're all paying for this, not better care.
Yeah, but the patient is the one that's the consumer of the product, so they think it's better care. Hence, they, the hospitals can charge.
Whatever they want.
Yeah, because it's better care theoretically. Better, your term, what you think better is different than what a patient thinks is better.
Well, until they get the bill.
Yeah, then it's over. So.
Then they're not that happy, and that's why we have this terrible. I think one of the leading causes of bankruptcy in America is medical debt.
Yeah,
because people don't know what the hospital is going to charge them. They go in for an ear infection to the ER, and they end up with an $1,800 bill that goes through the deductible, and they don't have what to pay with. So it's not a panacea. So I think the free market, and that's what DPC, direct primary care, is all about, is showing that is doable. And there's very big ones, for example, ChenMed, which is an internal medicine group, and they take full risk Medicare and Medicaid, and their internists only have 400 patients in the panel, and yet the doctors get paid more than the average doctor, and their costs are significantly lower than anybody else. So I think, don't believe that you can't make it in private practice. You have to hustle.
Right.
And it's very rewarding, and it can be done. But yes, the big health systems, they don't want that to happen because they want to keep a monopoly.
Yeah.
So what's your outlook on the business of medicine? We hear all this time, and I'm one of those guilty ones. I tell young people, forget medicine. Go have a good life, in your 20s, enjoy life in your 20s, work in a nice office, get lots of perks. I see some of my friends who are much younger, they only fly first class because the company sends them here and there. And they have so many miles, they fly first class, they stay at great hotels, they make twice as much as I make. They really live the rock star life. So what's your outlook on medicine as a whole?
Well, I see what you're saying, and it's really difficult to, well, it's not, I don't know if that's the right word, but it's easy to compare yourself to other people that are not doing medicine. Like, I have plenty of friends that are doing extremely well at the same age as me. They've bought houses, they're starting families already. But I try not to compare myself to them, because I know what I chose, and I chose this path, is what I've always been passionate for and what I'm truly interested in. I wouldn't have it any other way. I really do find interest in medicine and giving back to the community and doing these long hours to hopefully get to that goal where I am a doctor to really help others. So I don't really compare myself to those that are living that lifestyle right now and getting these company paid for events and company paid for lunches and whatnot. So I know that this will all pay off in the future, but in terms of this and the medicine and the outlook on business, I understand where you're coming from in terms of when you're saying about all these costs and how the hospitals are doing this. I find it very difficult to see myself, or not see myself, but I think private practice is slowly and still going to decline as a whole, because of what you said, where I didn't know any of these numbers. I didn't know any of these direct costs. And it is, I guess, indoctrinating to young future physicians like me who don't really have all of the experience in the private practice world, where they can see that it might be better for a patient to go to a private physician, or it might be better for a patient where they have decreased costs going to a private physician. I'm kind of just not told, but I do see where you're coming from, and do see that these hospitals are buying up all these smaller practices and are really trying to monopolize. So it's tough for me to give an outlook on what the future of business and medicine will be, but I don't have the brightest vision for the future, especially when a lot of people don't have firsthand business experience and are really seeing that it might just be fine and dandy to go work for a hospital, collect your paycheck, and go home.
So how would you change that? How would you, I mean, you're doing the club, which is great. How else would you get the message across that we need competition and we need to put the physician patient relationship at the center of all interactions?
Well, I think the first thing would be to look at this DPC um, form of
Model.
care, and really show that competition is king, and competition always benefits the consumer and decrease costs. The free market will eventually bring costs down and improve care. So I think if we can educate patients and maybe promote these kind of businesses, it'll really provide enough competition to these big monopolies that maybe they'll take a hit. It might not be a big hit, but it might be just enough that could force them to change and can force other physicians to really expand and open their minds as to different types of medicine and how to manage and how to go at these private or massive companies in order to benefit the patient themselves.
Yeah. I think it will be the big companies, the Fortune 500, because they pay so much and they're just hostage to what the hospital industry wants to charge them.
Right.
And they're finding out that when they open up direct primary care access, they can save tons of money. The quality improves. And they are already doing lots of things where they're paying for people to travel out of state to get their knee replaced at a place that has better quality and lower cost, and they'll pay for the family to stay in a hotel and do away with the deductible because they can save so much money if they can, shop it out.
Right.
And some people are like, well, okay, well, I get my family with me for a long weekend in this city, and I don't have to pay anything out of pocket for my knee replacement. And the company can, do it for 25,000 versus 150,000. So
Yeah,
I
but
think
that all ties into value-based contracts, and the hospital systems are contracted with insurance carriers to produce this service for this amount of money. It's all money at the end of the day. So they don't spend it here, they'll pick it up over here. So don't feel sorry for the hospitals. They always make it.
I don't feel sorry for the hospital. I'm glad there's more transparency.
Yeah.
So I can know that I can get my knee replaced, for $20,000, and the outcome's the same as opposed for the $150,000. And I'm frugal, so I'm going to go for that $20,000, even if I have to go to Oklahoma. What's the difference to me? It's just a surgery. And so I think there's hope for private practice.
Yeah.
There's hope for competition. But we need young, smart people, doctors, to engage.
Yeah. I've seen over the course of my career, this hospital game happens every 10 years. It's like turf wars. They want to I've seen hospitals take over practices, try to manage them for a while. And what do? They sell them back to their original owners because they couldn't manage them.
Yeah.
That has happened. Hospitals all have the clunky EHRs. They're very big, they're very clunky, very complicated. Family practitioners, internal medicine pediatricians can't function in those environments. Then they leave. I think private practice is good. If you manage it properly, you have good work plans, efficiencies, technology, relationships with patients, with carriers. If you can put all that into one package, you'll be okay. But I do fear, like if Spencer came out of school and he decided, I want to be Dr. Spencer, throw up a shingle like it was in the old days, could he survive? Could he launch a practice? I question that.
I think he could. He's smart.
Very
He's
smart,
driven.
but
I mean, he's
it's like
passionate about medicine, which is the
Yeah.
most important thing.
I think that's the most important thing, because he can go find money, he can get a loan, put money into it, he can work it like you're supposed to, work, and then pay back your loan, and then you'll start making money. But unfortunately, a lot of young kids, they come out and they think I graduated, so I'm entitled to get a lot of money from the get-go. Somebody told me once, a consultant says, your MD, all that does, it doesn't give you any guarantees. It doesn't give you a guarantee of success. It just gives you a little bit of a head start in life. So where these people start here, you start a little faster, and things move a little faster for you. You can get more resources, you can get more finances as an MD, but the rest of the trip is still a lot of hard work. Now, let me leave you with one thing, Spencer. If you do, my father told me this, if you do good medicine, the money will follow.
Right.
But if you follow the money, you'll never, ever do good medicine. And you can see that from the hospitals. They follow the money, and that's why they don't do good medicine so much.
Right.
But he's passionate about medicine. So
Yeah,
he's
gonna
going to
do
do
good
just
medicine.
fine.
Yeah, he'll do fine.
He'll do fine. He'll be a success. It's just, some people, like the hospitals, they go into medicine because they think they're going to make a lot of money. And when they realize they're not going to make a lot of money, they're not passionate about patient care, then they're miserable, really miserable. And then they got all the student debt to follow.
Yeah.
Right. And that was going to be my next point is when you say that like someone like me might be able to just get out of medical school and open up a practice, it's very difficult for someone that might be taking out $250,000 worth of loans to go and take on another loan to try and open up a private practice.
Correct.
So the whole future of private practice is, I see it to be very, very grim, just because we're gonna have to pay back our loans first before we could really even consider moving out of maybe a hospital system, getting our first few paychecks, paying back our loans in order to start up a business and take that jump.
And that's a shame. But to George's point, I just read yesterday, I think that some big hospital system in Texas dumped their pediatric primary care, and they had like 15 or 16 clinics, and they just dumped it. They can't make money at it. They don't want them anymore, and they just dumped them. And this group bought them, and they're closing several of them. And then the 13 that they're keeping open, they're firing the pediatricians, and they're just putting nurse practitioners in them. But that's been going on since George doesn't like it when they get political, but the first time that this happened was with Bill Clinton and Hillary Clinton. We were all going to be on HMOs, and we had this same craziness of the hospitals buying primary care practices, integrating all of this nonsense, and more than one hospital almost went bankrupt, and they walked back to the physician's office and said, we can't afford it, we can't manage it, we don't know how you guys make money. Leave. I mean, leave. But but we have restrictive covenants. We don't care. Leave. You don't have to pay us anything. We just don't want to have you on our payroll anymore. And they all went back to private.
And they all did fine.
And so, so we're sort of in the third round of this. So we don't really know what's going to happen, but the cost of care has to come down, and the student debt and the lack of income that a physician goes through from the time they leave college to the time they're actually practicing has to be accounted for. Right. We can't continue to ask people to spend all of their 20s being educated and then come out and making $150,000 a year working. It's just not feasible, and we're going to lose talent. So, but I hope that you're wrong. I hope that there's more competition and more smart people like you can go into private practice and do what they really want, which is to take care of patients and at the same time be able to pay their bills. Because you're not only paying your bills, you're paying your staff bills, taxes. You're serving the whole community with that money that you're making.
Correct.
So, but very interesting. Well, I didn't have a business of medicine club when I went to the medical school. So I think it's really cool you've started that.
Yeah, this is our third year. The club started in 2020. Last year was their first like official year. And then this year we're just trying to increase our on-campus presence. So
That's very cool. And what will happen when you graduate? Who will take over?
the first and second years run the club. The third and fourth years don't really have as much involvement with on-campus activities. They're in the hospitals all the time. They're not really on campus doing didactic lectures anymore. So it really comes down to finding first years that are passionate about this and that might want leadership positions and might want to learn a little bit more about the business field and hopefully improve and keep moving this forward as we go. Hopefully this could evolve to maybe lobbying to administration to throw in a lecture maybe once every semester that goes over a little bit of medical practice management or malpractice, just something, or how to code for insurance, just a little bit of something that sparks interest in the business side of medicine and can open up the student's mind a little bit.
Or how to read a contract. I mean,
Right.
You're going to be employed by the health system. You should know how to read a contract. And none of that's, it wasn't taught when I was in medical school.
It's done.
It's a shame. What else do you want to talk about, Shane?
I don't really have too much else. I think we hit some really good points. We had some great conversation. I just wanted to thank you guys for having me on, and I really appreciate you giving me the platform to kind of explain what I'm doing on campus and what I'm passionate about and how we could further improve the business side of medicine and maybe get some more people interested in this field.
Well, your plan B should be pediatrics. Come and join me, graduates.
Maybe he'll be
I thought I had brainwashed him when he was a shadow, but I guess not.
Maybe he'll be a pediatric urologist.
That's who I worked for this summer. I had a blast. It was actually really good.
Yeah, that's fun. Well, thank you, Shane. I'm sorry it was a little harsh on you.
No worries.
I just want you to know that things will turn around, and I think there's hope, and the free market always seems to be the best option for everybody.
Yeah.
And you're smart, you're passionate, you're driven by the right thing, which is to take care of patients. And I am sure I will see you as a success unless I'm not on this earth.
But we'll have to have him back when he graduates with the follow-up podcast with all these students that are doing the podcast with us.
All right.
You have any classmates that you think have a good story to tell? Send them my way.
Will do. I have plenty.
Okay, great. I'll see you, Spencer.
All right.
Bye-bye.
Have a great day. Thanks for joining us.
Thank you for having me.